Good morning, Mr. Jared.
Good morning.
How are you doing today?
I'm fine.
All right, my name is Eunice, and I'll be your nurse today. And I'm gonna do a comprehensive assessment test today. Okay?
Okay.
All right. So first of all, I'm gonna start with your head.
Okay.
Would you please stay
Stand up.
No, just yeah. That's cool. Okay. First, I'm gonna assess your shape of the head.
Okay.
It's nice and round.
Okay.
I'm gonna palpate and see if you have any masses. Tell me if you have any pain, okay?
Okay.
I'm gonna check the protrusions of your cranial bones, which are nice and smooth. Alright, next I'm gonna go to your face. I'm gonna assess your face, check if you have any lacerations, any scars. Okay, next I'm gonna assess your facial expressions. Would you please smile for me? Alright, clench your teeth for me. Clench it for me. Alright, do you feel any pain?
No.
Any discomfort?
No.
Alright, next I'm gonna assess your temporal artery. Palpate it first. Okay, I can feel the pulsations. Let me assess if I can feel any roots. Alright, no roots available. Okay, next I'm gonna assess your temporal mandibular joint. So, would you please open your mouth for me? Close. Again. Close. Okay, it's nice and no pain. Do you feel any pain?
No.
Alright, next I'm gonna go ahead and assess your eyes, your eyebrows.
Okay.
See if they are equal, symmetrical, bilateral on both sides. I'm gonna assess your eyelashes, which are evenly distributed. I'll assess your pupil and your eyeball, which is equal on both eyes, round and yeah. I can see. Next, I'm gonna assess your conjunctiva. I'm gonna hold it down, and you're gonna look up. It's nice and pink. No discharge, no swelling, and no redness. Alright, next I'm gonna assess, we're gonna do a few tests.
Okay.
And so we can see how good your eyes are, okay?
Okay.
Alright, so number one, we're gonna do a Snellen chart, which the Snellen chart, it assesses your visual acuity.
Okay.
So what I want is, I want you to start 20 feet away from the chart behind you, and yeah, so you can read, and I want you to read the lowest line you can read, okay?
Okay.
Alright, okay, come over here. Okay, read the lowest line you can read.
L T F B H.
Alright, go ahead and close your other eye and read.
L T F B H.
Okay, now read without covering your eyes.
L T F B H.
Alright, you did a good job, Jared.
Thank you.
That means you're okay, go ahead and sit down. That means you can see at a 20/20 vision, which means you can see the same line of letters that at a 20 feet of like a normal person can see, okay?
Okay.
Alright, the next thing we're gonna do a confrontation test.
Okay.
And a confrontation test, what it does, it assesses how well your eyes can see peripherally, like both sides, okay?
Okay.
So I'd like you to stand, and in an arm's length, I want you to cover your right eye, and I'll go ahead and cover my right eye. Then I want you to look on my left eye. Then you're gonna tell me how many fingers you can,
Okay.
you can, you can see, okay?
Okay.
But don't look at my fingers, look at my left eye. Then you're gonna change again and do
Okay.
the same, okay?
Okay.
All right.
2, 1, 3.
All right, good. Cover your other eye. Look at my right eye. Then you're gonna tell me how many fingers you can read, okay?
Okay. 5, 1, 3.
All right, good job, Jared. All right, go ahead and have a seat. Okay, the next test we're gonna do, it's called a diagnostic position test. And in this test, I'm gonna use a pen light. And this test, I'm gonna, place this pen light, and I want you to hold your head erect and, don't move your head. I want you to follow this pen light with just your eyes, okay?
Okay.
All right. All right, good job, Jared.
Thank you.
Okay, so the next thing we're gonna do is I'm gonna assess how well your pupil can react to light, okay?
Okay.
So I'm gonna turn off the lights. Then I'll shine in my pen light into your eyes and see how well your eyes constrict, okay?
Okay.
Look directly towards the wall, the farthest position you can. Okay, turn back on the lights. The next thing, I'll do an accommodation test, and in this test, I'm gonna, use the same pen light, and I want you to follow this pen light, because I'm gonna go further to your nose, so I want you to follow the pen light as it comes closer to the nose, okay?
Okay.
Alright, good job. This test shows how well your eyes can accommodate and how well your eyes process, because these tests the abducens, the trochlea and the optic nerve, and that means yours are intact, okay?
Okay.
The next thing I'm gonna use, I'm gonna assess your corneal light reflex, and what I will do, I'll shine my pen light at a 12-inch distance and see if the pen light gonna reflect the same on both eyes, okay?
Okay.
So look at the farthest position you can see on that wall, and as that right here, shine, and yes, the pen light shines all on your eyes equally, okay?
Okay.
All right, the next thing we're gonna do is I'm gonna assess your ocular fundus, and I'll use my ophthalmoscope. Change it. And in this test, I'm gonna assess your inner structures of the eyes. So what I want you to do is look the farthest point you can see.
Okay.
Then you can tell me if you feel any irritation or discomfort, okay?
Okay.
Alright, so I'm gonna first check for the red reflex. Then I'm gonna come slower, following the red reflex. Alright. So, little bit. Trying to assess. Okay. Okay. So I can assess your I can assess your blood vessels, which are well vastly on the optic disc. the arteries are a little brighter than the veins, and they all, you can see they all meet at the center of an optic disc. I can try to see the macula, which is the macula is a bit darker on the background. I can see no opacities. Okay, so next I'm gonna assess your other eye. Okay, open up your eye. I'm gonna follow the red reflex. Open up your eye. Good. I can see the blood vessels again. The blood vessels which merge at the center of the optic disc. You can see the optic disc, which is a creamy orange in color. No opacities, and the macula is somewhat darker than on the background. All right, Jared. Thank you so much. Seems your eyes are healthy.
Thank you.
Okay, so the next thing I'm gonna do is I'll assess your ears, and in this case, I'm gonna palpate. And I'll first inspect and see if you have any drainage, any bleeding on both ears. And check if they are equal bilaterally, of which I see they are equal. Then I'm gonna palpate and see if you have any pain. Please let me know, okay?
Yeah. Okay.
Palpate for any masses, any lumps, of which I didn't feel none. So the next thing I'm gonna use an otoscope. In this case, an otoscope. It's gonna assess your inner structures, see if you have any perforations, any bleeding. You comfortable with that?
Yes.
All right. So. So I'm gonna pull up your ear and back. Let me take this out first. Pull up your ear, then back. Then try and go in slowly. Try and locate the tympanic membrane first. But first of all, I'm trying to assess if I can see, I'm trying to look if I can see any foreign bodies, any bleeding, any perforations, of which is seen, but you have minimal cerumen, just a little bit, of which is normal. Then I'm trying to locate the tympanic. Good. It's I saw the tympanic membrane, which is gray and shiny, and it has no perforations, and it bulges slightly at the center. Alright, Jallard. Okay, I'm gonna go ahead and assess your other ear, okay?
Okay.
Gonna assess, pull up your ear, then back. Same case, I'll assess your ear and see if there's any foreign bodies. Assess if you have any bleeding, then go slightly further and see if I can find the tympanic membrane, of which, yes, it's shiny in appearance and it's gray in color. Okay. And it has no perforations. Same case, minimal cerumen, of which is normal. And yes. your ears are normal, okay?
Thank you.
Alright, so the next thing I'll do a whisper test, and in this case a whisper test, it tests how well you can hear, you know.
Okay.
So I want you to cover whichever ear. Let's start with this ear. Then I'm gonna whisper a word and you're gonna tell me what you heard, okay?
Okay.
Alright.
Jared. Table.
Alright, let's do the same on the other ear.
Car. Pencil.
Alright, good job. Alright, Jared, so next we're gonna go to your nose. I'm gonna assess your nose, and I'm gonna assess if it aligns, you know, medially on your face, of which I see it does. I see no lesions, I see no edema. Let me palpate, tell me if you have any pain, okay? Any pain?
No.
Alright, so next I'll assess your inside nose and see if you have any bleeding,
Okay.
any foreign bodies, or any, you know, deviations of your septum, okay?
Okay.
Alright. So you're gonna tilt a little bit. Okay. Right. So you got no abnormal findings because your septal deviation is, you got no septal deviations. It lies medially in your nose. Okay.
Okay.
All right. The same. The next thing I'm gonna assess is the patency of your nose. So I'll close one nostril, then you're gonna sniff on your other nostril, just if you have any obstructions. Okay.
Okay.
All right. Sniff. Sniff inside. Okay. Gonna close your other. Sniff. Down. Alright. Any pain?
No.
Alright, good job. So the next thing, I'm gonna assess your mouth and your throat.
Okay.
So assess your lips first and see if you have, I can see your lips are nice and pink. Your lips are moist. The next thing, I'll assess your teeth. Please open. Alright, your teeth are white and aligned. See your gum, got no bleedings. Would you please stick out your tongue for me? Alright, your tongue is nice and pink, moist. It has a white coating, which is normal. Would you please lay it on the side, like, yeah, you got roughened papilla, which is normal. Stick it on the other side, the same. Roughened papilla, same case. Stick it out, like face it up. Smooth, and you got veins which are showy. Alright, good job. So the next thing, I'll ask you to stick it out so that I can assess your, you know, your back part of the mouth. Okay.
Okay.
Use the pen light with a little bit. Alright, next thing, I'm gonna assess your hard palate, which is rough with hard rugae, which is normal. And I'm gonna assess your soft palate, which is smooth and nice and smooth, it is more pinker than the hard palate. So I'm sorry, stick it out a little bit. And access the uvula. The uvula, it's medially at the back. And what do you say? It vibrates as you say because it means your vagus nerve is intact. So stick that out a little bit more. And assess your tonsils. Your tonsils are pink papered, which are rough. Yeah, and they're visible, a 1+ grade, of which is normal. Okay.
Okay.
All right. Thank you so much, Jared. And next thing we're gonna do is we're gonna go to your neck. Okay.
Okay.